Welcome back, everybody. Ready to dive into some more of this psychopharmacology stuff?
Let's do it. Always fascinating stuff, especially when it comes to getting the diagnosis right.
Right, it's like high stakes when meds are involved. So much to consider.
Absolutely.
So we're still in part 2.pdf of that handbook for therapists, the one about prescribing meds.
Handbook of Clinical Psychopharmacology for Therapists.
Yeah, that one. And this section is really making me think differently about diagnosis.
In what way?
Well, they keep coming back to this idea that you can't just look at symptoms in isolation.
Totally. Like the same symptom can mean totally different things depending on the person.
Right, like they use this example. Someone looks like they've got both depression and borderline personality disorder. But treat the depression.
And the personality stuff vanishes. Poof.
Yeah, it's like the depression was masking the real person underneath.
It's a classic example of why misdiagnosis can be so dangerous. You end up treating the wrong thing.
Totally. And the handbook's point is that therapists need to be super careful about not misinterpreting personality traits as the core issue.
Because if you do that, you might try therapy that's just not going to be effective.
Like, it just won't address the root of the problem.
Exactly. And this whole personality thing gets even more complicated when you realize that personality isn't static.
What do you mean?
Well, the handbook calls it the principal disorder, like if someone has major depression or an anxiety disorder.
Okay, so like the main thing they're dealing with.
Right. It can actually make their pre-existing personality traits seem way more intense.
So it's not that their personality has changed, it's just that the illness is kind of amplifying things.
Exactly. Like imagine someone who's usually super independent, but then they get hit with a severe depression.
They might suddenly become really clinky and helpless.
That's it. It doesn't mean they've suddenly become a different person. It's the illness distorting things.
And on the flip side, someone's personality can make them more likely to develop certain mental illnesses in the first place.
Right. Think about it. An avoidant person might be more prone to developing social anxiety. Makes sense, right?
Totally. So you've got this two-way streets, the illness impacting personality, but personality also influencing the illness.
Exactly. And the handbook is saying that understanding these dynamics is key for both treatment and preventing relapse down the road.
Makes you realize how interconnected everything is.
It does. And then they throw in this other concept that blew my mind a little.
Oh, lay on me.
What if, and this is going to sound kind of radical,
I'm ready.
what if some personality traits that we think are just how someone is are actually because of like subtle, long-term biochemical imbalances in the brain?
Wait, so you're saying some personality traits might actually be treatable with medication?
Yeah, the handbook calls it characterological depression.
Interesting. So some of those deeply ingrained patterns might not be purely psychological.
Right. And the handbook suggests that these folks, the ones with this characterological depression, they often respond surprisingly well to medication.
Like, it's almost like their true personality was being held back by this biological thing.
Yeah, kind of. Like, think of it as unmasking the real person.
Whoa, that's heavy stuff. Makes you wonder how much of who we are is biology versus, life experiences.
Right. But it's important to remember that it's not always a biological issue. Sometimes therapy is the key.
Makes sense. So we've got personality influencing illness, illness influencing personality, and maybe even some personality traits being rooted in biology. My head is spinning.
It is complex. And all of this ties into another big point the handbook makes. Someone's personality style can really affect how well they respond to treatment.
Oh, so like whether it's meds or therapy, their personality is going to play a role.
Exactly. Like some people are naturally more resistant to change, some are more open.
So a good therapist isn't just looking at the symptoms in a vacuum. They're considering the whole person, their personality, their history, everything.
Exactly. And the handbook even cites research showing that people with complex personalities,
You mean like a lot of different things going on?
yeah, they often need longer, more intensive treatment to really see lasting changes. And usually it's a combo of meds and therapy. Cookie-cutter approaches just don't cut it.
This is fascinating. It's like a whole new layer of the diagnosis puzzle.
It is. And then, to make things even more complicated, there's substance use.
Oh, yeah, that can really throw a wrench in things, can it?
Big time. It's not just a separate issue. It can actually cause psychiatric symptoms that look just like other disorders.
So you could be treating someone for anxiety, but it's really heavy drinking that's messing with their brain.
Exactly. The handbook even gives an example of how alcohol affects the liver, which then messes with how antidepressants work.
So it's like trying to fix something, but there's this underlying issue that's sabotaging your efforts.
That's a good way to put it. And this handbook, remember, it's for therapists who are prescribing meds. So they're really hammering home the point that substance use has to be on everyone's radar. It can totally derail treatment.
Makes sense. You need to know what you're dealing with before you can start fixing it.
Exactly. Now, this might seem like a jump, but let's talk about caffeine for a second.
Oh, caffeine, my best friend and worst enemy.
Right. It seems harmless, but for people who are prone to anxiety.
Oh, too much coffee and I'm a wreck.
Right. The handbook makes this point that even small amounts of caffeine can be a problem for some people, maybe even triggering full-blown panic attacks.
Interesting. I always thought it was just me being sensitive. Why would caffeine do that?
Well, think about the physical symptoms. Racing heart, dizziness, that shaky feeling.
Sounds familiar.
It's very similar to what happens during a panic attack, so it can really set someone off who's already predisposed to anxiety.
So how much is too much, according to this handbook?
They recommend keeping it under 250 milligrams a day and definitely under 500. And it's not just coffee. We're talking tea, soda, energy drinks, even chocolate has caffeine.
Okay, that's making me rethink my afternoon pick-me-up.
It's definitely something to be mindful of, especially if anxiety is an issue.
So we've talked about how personality and substance use can complicate things, but this handbook throws in another curveball. Physical medical conditions that can mimic mental illness.
Right, it's like your body's playing tricks on you.
Yeah, it's crazy to think you could go to therapy for what seems like an anxiety attack, but it's actually hypoglycemia, or your thyroid is off.
The handbook has a whole list of these medical conditions that therapists should be aware of.
So it's another reminder that mental health isn't just in your head, it's connected to your whole body.
Totally, and sometimes the solution isn't in a therapist's office, it's a doctor's appointment.
Wow, this deep dive is really making me rethink a lot of assumptions about diagnosis. And we're just getting started.
Buckle up, there's a lot more to explore. Okay, so let's get into the nitty-gritty of depression. This handbook really emphasizes that it's not a one-size-fits-all kind of thing. It's a spectrum, right?
Right. Not just feeling sad. What are some of the different ways this handbook breaks it down?
Well, they talk about three main types: reactive, biological, and then a combo of the two.
Okay, so reactive depression, I'm guessing that's when it's triggered by, like, life events.
Yeah, exactly. Stuff like grief or job loss, those big changes that can really throw you off.
Makes sense. So your mind is basically trying to process all those tough experiences.
Exactly, but biological depression, that's a different beast.
What makes it different?
It can seem to come out of nowhere. Like, even if your life's going pretty well on the surface,
Huh. So what's the trigger then?
it might be more internal, could be hormones, brain chemicals being off, even your genes can play a role.
So it's like your brain chemistry is kind of the culprit there.
Yeah, that's a good way to put it. And then there's that combo type, the reactive biological. That one's interesting.
How so?
Well, it might start with some external stressor, like a big life event, but then over time, it kind of snowballs into a more biological depression.
Oh, wow. So it's like the initial trigger sets it off, but then your brain chemistry takes over and makes it even more complicated.
You got it. And when it comes to figuring out if meta might be helpful, the handbook talks about these vegetative symptoms.
Vegetative symptoms? I'm not familiar with that term.
Think of it as the physical ways depression shows up. So we're talking sleep problems, appetite changes, fatigue, that kind of stuff.
Okay, so those are kind of like the red flags that suggest there might be a biological component going on.
Exactly. And those are often the signs that medication might be particularly helpful.
Interesting. So if someone's feeling down, but they're still sleeping and eating normally, maybe meds aren't the best first step.
Right. Therapy might be a better starting point in that case. Now, there's this one type of depression that can really throw people off, atypical depression.
What makes it atypical?
It has some pretty unusual symptoms, like sleeping more, increased appetite, and being super sensitive to rejection.
Huh. So almost the opposite of what we usually think of with depression.
Yeah, kind of, which is why it's so important to catch this specific type.
Why? What happens if you miss it?
It's strongly associated with bipolar disorder, and with bipolar, antidepressants can actually backfire.
Oh, wow. How so?
They can actually trigger mania or make the illness worse over time.
Yikes. So accurate diagnosis is really crucial before starting any treatment.
Absolutely. Can't emphasize that enough. But even with all this complexity, most depressions, even the really tough ones, do respond well to treatment.
That's good to hear. Gives me hope.
Right. Most folks can find relief, but it often takes a multi-pronged approach, meds to address the biological stuff, therapy to work on the psychological stuff, and teach coping skills.
Gotcha. So it's kind of like a two-pronged attack,
Exactly. Plus, lifestyle changes can make a bigger difference than people realize.
like exercise, diet, all that.
Exactly. All that good stuff. It's empowering in a way. There are things you can do to feel better, along with professional help, of course. Definitely. Not just passively waiting for things to change.
Makes sense. Now, speaking of conditions that need that multifaceted approach, let's talk bipolar disorder. There seems to be a lot of misunderstanding about what that actually looks like.
There is a lot of people just focus on that manic part, the high energy, impulsivity, but there's so much more to it than that.
Yeah, I was going to say it's not just about being happy and productive all the time, right?
Not at all. And that's where this handbook is helpful. They really emphasize those swings, the highs and the lows, that roller coaster between mania and depression, and how disruptive, even dangerous it can be if it's not treated properly.
So let's break it down. When we talk about mania, what are we really talking about?
Well, the handbook lists the classic symptoms: elevated mood, racing thoughts, impulsivity, decreased need for sleep. That feeling of being invincible, like you can do anything.
But I imagine that feeling can lead to some risky behavior, right?
Absolutely. And that's part of the danger of mania. Judgment gets impaired even if the person feels on top of the world.
So like spinning sprees, reckless driving.
Exactly. All those impulsive actions that can have serious consequences.
And then, of course, there's the crash back down into depression, which I imagine can feel even worse after being on that manic high.
Often, yeah. And then there's the subtype called bipolar 2, where the manic episodes aren't as intense, but they still swing back and forth with depression.
So it's still bipolar, but a milder form.
Right. It's called hypomania, like mania light, but it can still be incredibly disruptive to someone's life. And the tricky thing is, it often goes undiagnosed
Why is that?
because people might not even recognize it as problematic.
Interesting. They might just think they're having a good day, a productive week, that kind of thing.
Totally. They might even feel good during a hypomanic episode. More creative, productive, outgoing, but it's still a mood episode and it needs attention. It can spiral.
So even the less intense forms of bipolar can have serious consequences if they're not addressed.
Absolutely. And when it comes to the causes of bipolar disorder, well, there's still a lot we don't know. But the handbook points to a few key things. Genetics are huge, especially family history.
So like if your mom or dad has bipolar, your chances of having it go up.
Exactly. But it's not just genes. They also talk about neurochemical imbalances.
Messing with those brain chemicals again?
Right. Dopamine, serotonin, all those get thrown off. And they even mention differences in brain structure in certain areas.
So it's that complex interplay of nature and nurture again. But even though there's no cure for bipolar, the good news is that there are effective ways to manage it, right?
Absolutely. This handbook is all about that, helping therapists understand the best treatment approaches. And with bipolar, medication is key, especially for stabilizing those mood swings and preventing those extreme highs and lows.
So like kind of keeping things more even-keeled.
Exactly. But medication alone isn't enough. The handbook is really big on therapy being just as important.
What role does therapy play in managing bipolar?
It's about giving people tools, coping skills, stress management, ways to address all the emotional and social fallout that often comes with bipolar.
So like helping them navigate the ups and downs and build a more stable life?
That's the idea. There are different types of therapy that can be helpful too. Cognitive behavior therapy, psychoeducation, family therapy. It really depends on the person and what they need.
Okay, so it's about finding the right combination of support and strategies to help each individual thrive.
Exactly. Now, let's move on to something I think everyone can relate to on some level.
Uh-oh, what's that?
Anxiety. You ever feel it?
Who hasn't?
Right. And anxiety disorders are way more common than most people realize. This handbook makes that clear. It's not just about feeling nervous every now and then. We're talking real clinical anxiety that can be debilitating.
Oh, I know that feeling. It can be completely paralyzing.
Exactly. And they make a good point about distinguishing between general anxiety and panic attacks. General anxiety, that's that constant worry that kind of hangs over you, that feeling of being on edge.
Yeah, like you just can't relax.
Exactly. But panic attacks, they're different. They're sudden, intense bursts of fear that seem to come out of nowhere.
I think we've all felt that at some point, right? Heart racing, can't breathe, feeling like you're about to lose it. It's terrifying.
It is. Racing heart, shortness of breath, dizziness, that feeling of losing control. Classic panic attack symptoms.
Yeah, not fun. And the thing is, anxiety can take so many forms.
It does. The handbook goes through all the different types: generalized anxiety disorder, phobias, panic disorder, agoraphobia. It's like anxiety wears all these different masks.
But it's still anxiety underneath. Can we break some of those down, those specific types? I think it would be helpful for listeners to really understand the differences.
Sure. Generalized anxiety disorder, that's that constant worry that seeps into everything. Like you're worrying about work, relationships, health, money. It's pervasive.
I know some people like that. They just can't seem to shut off the worry switch.
Right. Then there are phobias, intense, irrational fears of specific things: spiders, heights, social situations, you name it.
And panic disorders, recurring panic attacks, right? Plus, that constant fear of having another one.
Exactly. which can be just as debilitating as the attacks themselves. And then agoraphobia is the fear of situations where escape might be difficult or embarrassing.
So like crowds, public transportation, those kinds of things.
Right. Being stuck somewhere where you feel trapped. And the point the handbook makes is that each of these types needs a different approach to treatment. There's no one size fits all.
So like just telling someone with a phobia to down isn't going to do much.
Not really, no.
Makes sense. So how does anxiety work? Why do we even have these responses?
Well, to really get it, the handbook says you have to understand the brain and body's reaction to threat, that fight or flight response.
Ah, that primal instinct. Like when you see a tiger in the jungle, you either fight or run away.
Right. And the handbook breaks it down like this. Your brain perceives a threat, right? Doesn't even matter if it's real or imagined.
So your brain's like, danger? Danger?
Exactly. And that sets off the amygdala, which is the fear center in your brain.
Okay, so the amygdala is like the alarm bell.
Yeah, good analogy. Then signals go through your nervous system. All these stress hormones get released, adrenaline, cortisol, and that's what causes all those physical symptoms of anxiety.
The racing heart, sweating, shaking. Your body's getting ready to fight or flee, even if the danger is just a presentation at work.
Exactly. And with anxiety disorders, the system is stuck on overdrive. So even when there's no real danger, your body's reacting like there is. It's exhausting.
Sounds like it, like your internal alarm system is super sensitive, always going off for no reason.
That's a good way to put it. And here's another point they make. Sometimes anxiety isn't actually anxiety. It's a symptom of something else entirely.
Like what?
Could be a medical condition, for example, or substance withdrawal. Like someone could go to therapy thinking they have anxiety, but it turns out their thyroid's out of whack.
Wow, so many possibilities. It's like being a detective, trying to figure out the real culprit.
Right. The handbook lists a bunch of examples: thyroid disorders, heart problems, withdrawal from caffeine or alcohol. They can all mimic anxiety.
So again, it comes back to looking at the whole picture, not just jumping to conclusions.
Exactly. And when it comes to treatment, well, there's no magic bullet for anxiety. It's about finding the right combination of approaches for each person. And therapy is often a good part of that.
What kinds of therapy are we talking about?
Cognitive behavioral therapy, for one, that helps people change those unhelpful thoughts that fuel anxiety. Then there's exposure therapy, which helps people gradually face their fears in a safe environment.
So kind of like retraining your brain to react differently to those triggers.
Exactly. And relaxation techniques and mindfulness can be huge for calming that nervous system down. And then there's medication, which can play a role too, especially in those more severe cases.
What kind of meds are usually prescribed for anxiety?
Antidepressants, especially SSRIs and SNRIs, are often the first line of treatment. They help regulate both mood and anxiety.
Okay, so they kind of tackle both sides of it.
Yeah. And then for short-term relief, there are anti-anxiety meds like benzodiazepines, but those have a higher risk of dependence, so they're not usually a long-term solution.
Makes sense. So it's about finding the right balance: therapy, lifestyle changes, maybe medication, whatever it takes to give the person the best chance of getting their anxiety under control.
Exactly. Now let's dive into a condition that's often misunderstood, even made light of:
What's that?
obsessive-compulsive disorder, or OCD.
Oh, yeah. I think a lot of people hear OCD and picture someone who just likes things clean and organized, but it's so much more than that, isn't it?
It is. This handbook really gets to the core of it. It's about obsessions and compulsions.
Okay, so break those down for me. What exactly are we talking about?
Obsessions are those intrusive, unwanted thoughts that cause intense distress. They can be about anything: contamination, harm, religion, you name it. And they feel completely uncontrollable.
So it's like your mind is stuck on repeat, playing these awful thoughts over and over, no matter how hard you try to stop them.
Exactly. And then there are the compulsions. These are repetitive behaviors aimed at reducing the anxiety caused by those obsessions. And they don't even have to make sense logically.
Right. It's like, it's irrational, but you feel like you have to do it anyway.
That's it. It feels absolutely necessary to the person with OCD, even if it doesn't make sense to anyone else.
So like washing your hands 100 times a day or checking the stove 50 times before you leave the house.
Exactly. And the handbook makes it clear that OCD is different from just being a neat freak or a perfectionist.
Right. Important distinction. I think a lot of people throw around the term OCD casually, but it's a real serious mental illness. It can take over your life.
It can. And with OCD, those obsessions and compulsions become debilitating. They interfere with work, relationships, everything.
Wow. So this handbook's for therapists who are prescribing meds, right? What does it say about the biological side of OCD?
It's fascinating. They talk about overactivity in certain brain circuits, especially those involving the frontal cortex and basal ganglia. It's like those areas are stuck in overdrive.
Okay, so how does that translate into obsessions and compulsions? What's the link?
Well, there are a couple of theories. One is that it creates this feedback loop in the brain. The worry, the obsession, triggers the compulsion, which then eases the anxiety for a bit.
So you get temporary relief.
Right. But the problem is that by doing the compulsion, you actually strengthen that neural pathway, making it more likely that the whole cycle will just repeat itself.
So the more you give in to the compulsion, the stronger that connection becomes.
That's the idea. And then there's another theory that in OCD, the brain's danger response system doesn't shut off properly. So you're basically in a constant state of feeling threatened, even when there's no real danger. It's exhausting.
Sounds like it. Always on high alert. No wonder people with OCD are so anxious.
Exactly. Now, when it comes to breaking free from OCD, this handbook highlights exposure and response prevention therapy as being really effective. It's called ERP for short.
ERP. Okay, how does that work? What's the approach there?
It involves gradually exposing people to the things that trigger their obsessions, but the key is that you help them resist the urge to do the compulsion.
So, like, if someone's obsessed with germs, you might have them touch something dirty and then not let them wash their hands.
Exactly. It sounds tough, but it really works. It's like rewiring the brain, breaking those automatic patterns. And medication can play a role too, especially in those more severe cases, SSRIs, which are those antidepressants we talked about.
Wait, those can help with OCD too? I thought they were just for depression and anxiety.
They can. It seems like they work by increasing serotonin activity in those brain areas that control anxiety and impulsivity, which helps dampen those overactive circuits.
So it's like turning down the volume on that out-of-control fear response.
Exactly. It's all about calming those overactive brain regions. Okay, ready to switch gears. We're going to head into some more uncharted territory now.
Lay it on me. What's next?
Psychotic disorders.
Ooh, that was a little intimidating, to be honest. It feels like a world apart from what most people experience.
I get it. It is different, but I think this handbook does a good job of explaining it in a way that's clear and accessible, even if you're not a mental health professional.
Okay, good. So what's the basic concept of psychosis? What's the core idea?
It's basically a break from reality, a disconnect from what's actually happening.
So, like living in your own world.
Kind of, yeah. The handbook lists a few key features of psychosis delusions, hallucinations, and disorganized thinking.
Okay, let's unpack those. Starting with delusions. What are those?
Delusions are basically false beliefs that are really firmly held, even when there's evidence that contradicts them.
So, like, someone might be convinced that they're being followed by the government or that they have special powers, that kind of thing.
Exactly. It's like their mind is creating this alternate reality that feels totally real to them, even though it doesn't match up with what's actually going on.
And what about hallucinations?
Those are sensory experiences that aren't real. So hearing voices, seeing things, smelling, or tasting things that aren't there, that kind of thing.
That sounds incredibly disorienting.
It can be. And then there's disorganized thinking. That's when someone has trouble thinking clearly and logically. Their speech might be jumbled, they might act erratically, have a hard time following conversations.
So, like, their internal world is kind of falling apart.
Yeah, that's a good way to describe it. And I imagine all of this must be incredibly frightening, both for the person experiencing psychosis and for the people around them. Definitely. This handbook really emphasizes that psychosis isn't something people can just snap out of. It's scary, it's confusing, and it requires professional help.
Makes sense. So when we talk about psychotic disorders, what are some of the different types?
Well, I think schizophrenia is the most well-known. It's a chronic, severe disorder with a wide range of symptoms, including those we just talked about. But it's not the only type of psychotic disorder.
What else is there?
There's schizoaffective disorder, which is kind of like a blend of schizophrenia and a mood disorder. So they have psychotic symptoms plus mood symptoms like depression or mania.
Well, that sounds like a really tough combination to deal with.
It can be. And then there's delusional disorder, where the main symptom is, you guessed it, delusions. But they don't have as many hallucinations or that disorganized thinking.
Okay, so it's more focused on those false beliefs.
Exactly. And then, of course, there's substance-induced psychosis, triggered by drug use.
So some drugs can actually make you lose touch with reality.
They can, yeah. It's pretty scary. And lastly, there's what's called psychotic disorder due to a medical condition, which means some underlying physical illness is actually causing the psychosis.
So like a brain tumor or a hormonal imbalance.
Right? It's yet another reminder that sometimes the root of a mental health issue isn't mental at all. It's physical.
Whoa. So many layers to this. It's amazing how much we're learning from this handbook. What does it have to say about schizophrenia specifically? The causes, the treatment, that kind of thing. It seems like one of the most mysterious mental illnesses out there.
It is, and there's still a lot we don't know. But the handbook says it's likely caused by a combination of things. Genetics definitely play a big role. Having a family history of schizophrenia increases the risk.
So it's one of those things that can run in families.
Right, but it's not destiny. Like, not everyone with a family history develops it. There are other things that might be involved, like neurodevelopmental problems, so disruptions in brain development very early on, that might set the stage for schizophrenia later.
Interesting. So it could be a combination of being genetically vulnerable and having something happen in your environment that kind of triggers it.
Yeah, that's one theory. And then, of course, there's the brain chemical angle. Just like with so many other conditions, problems with dopamine seem to be involved in schizophrenia, too. And that stressful life events can also contribute.
So it's complex, just like everything else we've talked about. But the important thing is that even though there's no cure for schizophrenia, it can be managed, right?
That's right. And this handbook makes that clear. Medication is considered the cornerstone of treatment, specifically antipsychotic medications, which help reduce those core psychotic symptoms.
So those meds are basically helping the person come back to reality.
In a sense, yeah, they're helping to quiet those hallucinations, those delusions, those disorganized thoughts. But the handbook stresses that medication alone isn't enough. Therapy is really important too.
What role does therapy play in schizophrenia treatment?
It can help people cope with the challenges of the illness, improve social skills, manage their symptoms day to day, that sort of thing.
So it's kind of like giving them the tools and support to live a more fulfilling life despite having schizophrenia.
Exactly. And social support is huge too. Family, friends, support groups, that whole network can make a world of difference.
It sounds like it takes a village.
It often does. And one of the biggest takeaways from this handbook is that early intervention and consistent treatment are key for improving outcomes. The earlier someone gets help, the better. It can really help prevent further decline and make a huge difference in their recovery.
That's really good to know. Okay, let's switch gears again. Let's talk about a condition that I think often gets lumped in with anxiety, but it's really its own thing.
What's that?
Post-traumatic stress disorder, PTSD.
PTSD. Yeah, that was a tough one. And it's more than just an anxiety disorder. This handbook makes that clear. Anxiety is a big part of it, but PTSD can lead to all sorts of other problems too. Depression, for example. Sometimes even temporary psychosis, dissociation, anger problems, substance abuse. It's complex.
So it's like the trauma just kind of ripples out and affects your whole system, not just your emotions, but how you see the world, how you cope.
Exactly. And it's not something you can just get over with willpower. It takes a deep understanding of what trauma does to your brain and body, plus the right kind of support and treatment.
So let's get into the specifics. What are those hallmark symptoms of PTSD? How do you know if someone might be struggling with it?
The handbook breaks them down into a few main categories. First, there's re-experiencing the trauma.
So like flashbacks, nightmares.
Exactly. Intrusive thoughts, too. Even physical sensations that can bring you right back to that traumatic moment. It's like your body is reliving it, even though it's in the past.
That sounds awful. And I'm guessing those experiences lead to a lot of avoidance?
Absolutely. That's the next category, avoidance. People with PTSD will avoid anything that reminds them of the trauma. People, places, conversations, you name it.
I could see how that would be a natural response, trying to protect yourself from more pain.
It is, but it also prevents healing in the long run. It's like you're constantly running from the past. And then there's emotional numbing, which is another common symptom.
Emotional numbing, what's that like?
People feel detached, empty, like they can't experience joy or other positive emotion. It's like their emotional world has gone flat.
I imagine that makes it hard to connect with others, to feel alive.
It does. And then the last cluster of symptoms is hyperarousal.
Hyperarousal. So like being jumpy all the time.
Yeah, like you're constantly on edge, easily startled, having trouble sleeping. It's like our nervous system is on high alert, always expecting danger, even when there's none.
So it's not just about the initial trauma itself. It's about how that trauma changes your whole way of being in the world.
Exactly. And this handbook does a great job of explaining how PTSD can actually change the brain, like physically alter its structure and function.
Really? So it's not just a psychological thing, it's a physical thing too.
It is. The amygdala, that fear center we talked about earlier, it goes into overdrive, which makes you super sensitive to any kind of threat, whether it's real or imagined. And the hippocampus, which is involved in memory, also gets messed up. So memories become fragmented, and it's hard to distinguish between past threats and present ones.
So it's like your brain gets stuck in trauma mode, Always scanning for danger.
Exactly. And all of this is fueled by those stress hormones we talked about earlier, cortisol, adrenaline. They flood your system during the trauma, and they're actually what create those changes in your brain.
So understanding that PTSD is a physical wound, not just an emotional one, is huge. But what about healing? Can those brain changes be reversed? Is there hope?
That's the good news. The brain is incredibly adaptable. It can heal. And this handbook really emphasizes that therapy is key for PTSD recovery. It gives people a safe space to process the trauma, learn coping skills, start to feel in control again.
So it's about helping them feel safe and empowered.
Exactly. What kind of therapy works best?
That's what I was wondering. Are there specific types that are particularly effective for PTSD?
There are. Trauma-focused therapies are especially helpful, things like EMDR or certain types of CBT. And support groups are good too, connecting with people who understand, who've been through similar experiences.
That shared understanding can be so powerful.
It is. It helps you realize you're not alone. And medication can sometimes be part of the treatment plan too, although it's not always necessary.
What kinds of meds are helpful for PTSD?
Antidepressants can ease some of the depression and anxiety. And there's a medication called Prazosed that's specifically for nightmares, which are a common PTSD symptom.
Interesting. So there are definitely options out there, both medication and therapy. It's just about finding the right approach for each person.
Absolutely. And this handbook really emphasizes the need for a compassionate and individualized approach with PTSD, recognizing that trauma is a deeply personal experience and healing has to be too.
That makes a lot of sense. Okay, we've covered a lot of ground already, but I know there's still more to come. What's next on our deep dives agenda?
Borderline personality disorder. It's one of those diagnoses that often gets misunderstood and even stigmatized.
Yeah, I was going to say, it seems like BPD has a really bad reputation. People often see it as being manipulative or attention-seeking, but it's so much deeper than that, isn't it?
It is, and it's not easy. It can be a really challenging condition, both for the person experiencing it and for the people around them. This handbook doesn't sugarcoat it. They're very upfront about that.
Okay, so let's unpack it. What does the handbook say about the core features of BPD? What are the hallmarks of this diagnosis?
Well, one of the biggest ones is that intense fear of abandonment, like this terror of being left alone or rejected. It can be really overwhelming.
I can imagine. And that fear can lead to behaviors that actually push people away, right? Like it becomes this self-fulfilling prophecy.
Exactly. And then there are those unstable relationships that are so characteristic of BPD.
Yeah, I was going to ask about that. What's going on with relationships in BPD? They can be so chaotic and intense.
They can. It's like this constant back and forth between idealizing someone and then devaluing them.
It's like they're searching for that perfect, unconditional love, but they're also terrified of getting hurt. So they sabotage things before they can get too close.
That's a great way to put it. And then there's the identity disturbance that's often part of BPD. People with BPD might feel really lost and confused about who they are, their values, their purpose in life. It's like they're trying to put together a puzzle, but the pieces don't fit.
Yeah, that lack of a solid sense of self, I can see how that would make life really difficult.
Right, and then there's the impulsivity that often goes along with BPD, acting without thinking, engaging in risky behaviors, needing instant gratification. It's like their emotions are in the driver's seat and their rational mind is struggling to keep up.
And those emotions tend to be pretty intense in BPD, right? Like big mood swings, going from happy to angry to despairing really quickly.
Exactly. It's like their emotional thermostat is broken. And all of this can be really overwhelming. Sometimes it leads to self-harming behaviors like cutting or even suicidal thoughts. It's a way of coping with all that unbearable emotional pain.
That's really heavy stuff. It sounds so painful. I can see why it's important to get the right diagnosis and the right support.
It is, but the good news is that BPD can be treated. And this handbook really emphasizes that BPD is not a choice. It's not a personality flaw. It's a serious mental illness. And it usually stems from a combination of nature and nurture, right? It's like this perfect storm of vulnerability and difficult experiences.
And the handbook actually mentions that there are even some differences in brain structure in BPD, especially in the areas that control emotional regulation, impulsivity, self-awareness, that sort of thing.
Exactly. So it's not just about thinking differently or choosing to behave better. There are actual physical differences in the brain.
That's really important to remember. It helps us understand that BPD is a real illness, not just a personality quirk. But thankfully, there are treatments that can help. What does the handbook say about finding stability with BPD?
One of the main things they highlight is this type of therapy called dialectical behavior therapy, or DBT. Have you heard of it?
Yeah, I have. I've heard really good things about DBT, actually. What makes it so effective for BPD?
Well, it was actually developed specifically for BPD. It focuses on teaching people very specific skills to manage those intense emotions, have better relationships, and feel more stable in who they are.
So it's about empowering them to take control.
Exactly. DBT uses mindfulness to help them become more aware of their thoughts and feelings in the moment. And then there's distress tolerance to help them cope with those overwhelming emotions without resorting to self-harm or other unhealthy behaviors. Emotion regulation is another big one.
Yeah, learning to ride those emotional waves without getting swept away.
Exactly. And then lastly, there's interpersonal effectiveness, which is all about improving communication and building healthier relationships.
So DBT covers a lot of ground. It sounds like it's really tailored to the specific challenges of BPD. So even though BPD is often considered a lifelong condition, people can learn to manage it and live fulfilling lives.
That's what this handbook emphasizes, finding that balance, feeling like you have some mastery over your emotions, even if they're intense. It's possible.
That's really good to know. Okay, let's switch gears again, talk about something that affects so many people, substance use disorders. It's a tough topic, but it's important to talk about.
It is, and this handbook, being for therapists who are prescribing medication, they really drive home the point that addiction is a disease, not a moral failing.
Yeah, that's a crucial message. I think there's still so much stigma around addiction, but it's really important to understand that it's a medical condition that needs proper treatment.
Exactly. It changes the brain just like any other illness, and treatment needs to take that into account. So, in terms of what this handbook highlights as those key features of substance use disorders,
What should therapists be looking for?
they talk about loss of control, tolerance, withdrawal, and cravings. So, loss of control means you just can't seem to limit how much you use, even when it's causing serious problems in your life.
So you know it's bad for you, but you can't stop.
Right. It's like the substance has taken over your decision making, even when it's hurting you and those around you. And then tolerance means you need more and more of the substance to get the same effect.
Because your body gets used to it.
Exactly. It's like chasing a high that keeps getting further and further away. And then, of course, there's withdrawal, which I'm sure you know can be pretty brutal.
I've heard some horror stories.
It's those awful physical and mental symptoms that happen when you stop using the substance. Could be anxiety, shaking, sweating, nausea, insomnia. It can be really, really tough, and a lot of people relapse just to avoid those withdrawal symptoms.
That makes sense. And on top of all that, there are cravings, that intense urge to use, that constant thought of the substance. It must be hard to think about anything else.
It is, and that's the thing with addiction. It's not just about willpower. There are really powerful biological and psychological forces at play. This handbook goes into some detail about how substance use actually hijacks the brain's reward system. It floods it with dopamine, which is that feel-good neurotransmitter.
So it's like the substance becomes the main source of pleasure, and everything else pales in comparison.
Yeah, that's a good way to put it. And over time, those reward pathways get sensitized, so it's harder and harder to feel good from anything other than the substance, which is why it's so hard to break free. It's not just about stopping a behavior, you're literally rewiring your brain.
That's a really helpful way to understand it. So how do we approach treatment? It seems like it's a lot more complicated than just telling someone to quit.
It definitely is. And this handbook, it outlines a bunch of different treatment options, each kind of tackling a different piece of the puzzle. Detox is often that first step. That's about getting someone safely through those withdrawal symptoms in a medically supervised setting.
So it's about making that initial break as safe and comfortable as possible. Harm reduction.
Exactly. And then therapy is a huge component of addiction treatment. It helps people understand why they use, develop those coping skills for cravings and triggers, build a support system to help them stay sober.
So it's about addressing those underlying issues, not just the behavior itself.
Right. There are different types of therapy that can be helpful too. Individual therapy can be good for really unpacking your relationship with the substance and figuring out those personal triggers. Group therapy is great for connecting with others who get it, which can help with the isolation and shame that a lot of people with addiction experience.
That feeling of not being alone can be so powerful.
It is. And then there's family therapy, which can be really helpful for repairing relationships and building that support system at home, because addiction doesn't just affect the individual, it affects the whole family.
Absolutely. It's a ripple effect. And I know a lot of people find support groups to be really helpful too, like 12-step programs and things like that.
Yes, those can be a lifeline for a lot of people. They give you that sense of community, that long-term support that's so crucial for staying sober. It's like having a safety net, knowing there are people you can turn to when things get tough. And the handbook mentions medication as well. It can play a role too.
Oh yeah, what about meds for addiction? What can those do?
Well, particularly for alcohol and opioid addiction, certain medications can be helpful for reducing cravings, managing withdrawal, and even blocking the effects of the substance so it's not as rewarding to use, like taking away some of its power.
So it's like giving people that extra edge, that extra support to make it through those early stages of recovery?
Exactly. And the big takeaway from this section on substance use disorder is that recovery is a journey. It's not a one-time thing. It takes commitment, it takes support, and it takes being willing to work through those ups and downs.
It's about progress, not perfection.
Love that. Okay, let's switch gears completely. Ready to talk about something that's fundamental to everyone's well-being, no matter what mental health challenges they might be facing.
I'm intrigued. What is it?
Sleep.
Sleep. Ah, yes, the thing I never get enough of.
Who does, right? But we all know how awful we feel after a bad night's sleep, and I think a lot of people underestimate just how much sleep impacts our mental and physical health.
It's like the foundation for everything else.
It is, and this handbook goes into all sorts of sleep disorders, not just insomnia, which is the one everyone always talks about.
So what else is out there? What are some of the sleep disorders that people might not be as familiar with?
Well, they mention hypersomnolence disorder, which is basically excessive sleepiness. Like, even after you've gotten what seems like enough sleep, you're still exhausted.
So you're sleeping a lot, but you're still tired.
Exactly. And then there's narcolepsy, those sudden sleep attacks that can happen anytime, anywhere.
Oh, wow, I've heard about that. That sounds scary, especially if you're driving or something.
It is. And then there's nightmare disorder, recurring, distressing nightmares that really mess with your sleep quality. And sleep apnea is a big one.
Sleep apnea, that's the one where people stop breathing in their sleep, right?
Exactly. And it's not just about snoring loudly, it's about those breathing interruptions that can really affect your health in the long run. So, to understand any of these sleep disorders, you have to understand how sleep works in the first place.
Okay, so back to basics. Remind me how sleep works. What's the science behind it?
The handbook explains the circadian rhythm, which is basically your body's internal clock.
Ah, our natural sleep-wake cycle.
Right. It regulates all sorts of bodily functions, including when you feel sleeping and when you feel awake. But all sorts of things can mess with your circadian rhythm. Shift work, for example, jet lag, even being on your phone or computer late at night.
That blue light, it's a killer.
It is. It tricks your brain into thinking it's still daytime. So, given all that, how do we actually improve sleep? This handbook suggests starting with good sleep hygiene.
Okay, so what does sleep hygiene mean? Is it like brushing your teeth for your brain?
Kinda, yeah. It's about creating those habits and routines that promote good sleep, sticking to a consistent sleep schedule, for example, having a relaxing bedtime routine, avoiding caffeine and alcohol before bed.
So it's all about setting the stage for good sleep, not just hoping it happens magically.
Exactly. And they also talk about a specific type of therapy that can be really helpful for insomnia. It's called CBTI,
CBTI, what's that stand for?
Cognitive Behavioral Therapy for Insomnia.
Okay, so it's like CBT, but specifically focused on sleep problems.
Right. It helps people challenge those unhelpful thoughts and behaviors that are keeping them from sleeping well.
So like if you're lying in bed worrying about all the things you have to do tomorrow, or you keep checking the clock, CBTI can help you break those habits.
Exactly. And sometimes medication is an option too, especially if there's an underlying medical or psychiatric condition that's messing with sleep.
Like what kinds of medications are we talking about here?
Well, there are sleeping pills. They're sometimes called hypnotics. Those can be helpful for short-term insomnia, but they can also have side effects, and they're not usually a good long-term solution.
So it's more like a temporary fix.
Right. And then there are benzodiazepines, which we talked about with anxiety. Those can help with sleep too. But again, there's that risk of dependence, so they're not usually prescribed for long-term use.
Makes sense. What else is there?
And then there's melatonin, that's a natural hormone that helps regulate sleep. And some people find supplements to be helpful, especially for things like jet lag or shift work.
So it's like giving your body's natural sleep system a little boost. Interesting. So many options to explore. But the big takeaway from this section on sleep is that it's important. And good sleep often takes work. It's not something that just happens passively. You have to address any medical or psychiatric issues that might be playing a role. Build those healthy sleep habits. And reach out for professional help when you need it.
I love that summary. You really hit the nail on the head. It's about making sleep a priority, not just an afterthought.
Couldn't agree more. Okay, ready for our next deep dive.
Bring it on. What do we got?
Tourette syndrome.
Tourette's. Okay, this one's interesting because I think a lot of people have misconceptions about what Tourette's actually is.
Yeah, when I hear Tourette's, I think of those uncontrollable tugs, especially the vocal ones, like shouting out random words or phrases.
Right, and that's definitely part of it. But this handbook does a good job of explaining that while coproalia, that's the involuntary swearing, does exist, it's actually pretty rare. Most people with Tourette's don't experience that.
So that's more of a Hollywood stereotype than anything else.
Pretty much, yeah. Most texts are actually motor movements, like eye blinking, head jerking, shoulder shrugging, that sort of thing.
Okay, so it's more about those physical, jerky movements. And what about vocal texts? What do those sound like?
They can be things like throat clearing, sniffing, grunting, repeating words or phrases, that sort of thing.
Interesting. So it's a wide range of behaviors. Any idea what causes Tourette's?
Well, the exact cause is still being researched, but the handbook points to problems with dopamine pathways in the brain as a likely culprit.
Dopamine again. That seems to be a common thread in so many of these conditions.
It is. It's such an important neurotransmitter involved in so many brain functions. In the case of Tourette's, it seems like the circuits that control movement and speech are kind of misfiring, leading to those involuntary tics.
So it's like the brain is sending out these signals that the body can't control.
That's a good way to put it. So what can people with Tourette's do to manage these symptoms?
Yeah, is there anything that can help?
Well, there's no cure for Tourette's, but there are definitely treatments that can help manage the symptoms. Medication can be helpful, especially antipsychotics, which can reduce the severity of the tics.
Okay, so meds can kind of dial down the intensity.
Right, and there's also behavioral therapy, specifically something called habit reversal training, which can actually help people gain some control over those tics. Pretty cool.
So you're not just stuck with them. There are things you can do to manage them. That's empowering.
It is, and the handbook also talks about the importance of therapy, both individual and group therapy, to help people cope with the emotional and social challenges that often come along with Tourette's.
Yeah, I can imagine it could be really tough to live with a condition that makes you stand out or feel different, especially as a kid.
Absolutely. So therapy can be a really valuable space for processing those feelings and learning coping strategies. And the handbook really stresses that early intervention and a supportive environment are key. Like, the earlier you get help, the better equipped you are to handle the challenges.
Makes sense. Okay, I'm ready for our next topic. What have we got?
Eating disorders. It's a topic that's often shrouded in secrecy and shame.
Yeah, it's one of those things people don't like to talk about, but it's so important to bring it out into the open because eating disorders are serious.
They are, and this handbook does a really good job of emphasizing that they're serious mental illnesses, not just about vanity or dieting. These are complex conditions that can be life-threatening.
Right, it's not just about wanting to be thin. It's about deeper psychological struggles that are playing out through a person's relationship with food. Can we break down the different types of eating disorders? I think a lot of people are confused about the distinctions.
Absolutely. The handbook focuses on the three main ones: anorexia nervosa, bulimia nervosa, and binge eating disorder.
Okay, so let's start with anorexia. What's the defining feature there?
Anorexia is that relentless pursuit of thinness. It's about that intense fear of gaining weight and this distorted body image where you see yourself as much larger than you actually are.
So your mind is basically playing tricks on you, showing you something that's not real.
Right. And people with anorexia, they severely restrict how much they eat, sometimes to the point of starvation. They might also exercise excessively or use purging behaviors like vomiting to control their weight.
It could be so damaging to the body. And what about bulimia? How is that different?
Bulimia is characterized by those cycles of binge eating and purging. Binge eating is when you eat a large amount of food in a short period of time, often feeling out of control. And then purging is those behaviors people use to try to compensate for that binge, like vomiting, using laxatives, or overexercising.
So it's that back and forth, that struggle to control those urges. And binge eating disorder is similar to bulimia, but without the purging.
Exactly. People with binge eating disorder also experience those out-of-control eating episodes, but they don't engage in those compensatory behaviors afterward, and they often feel a lot of guilt and shame around those binges.
So with all three types, there's this intense emotional component that's driving the behavior. It's not just about a desire to be thin.
Exactly. And the handbook does a great job of explaining that eating disorders are complex, and they stem from a combination of factors: genes, psychology, social influences.
So it's not a simple answer.
Nope, not at all. Genes definitely play a role. Having a family history of eating disorders or other mental illnesses in general increases the risk. So there's that biological vulnerability.
Makes sense. What about the psychological piece?
Things like low self-esteem, perfectionism, anxiety, depression, all those can contribute to disordered eating.
It's like those underlying emotional struggles kind of fuel that unhealthy relationship with food.
Right, and then there's the social piece, which is huge. We live in a culture that puts so much emphasis on thinness, and that pressure can be really damaging, especially for people who are already vulnerable.
Yeah, it's that constant bombardment of images, that message that your worth is tied to your weight.
Exactly. And when all of those factors come together, the genes, the psychology, the social pressures, it can create this perfect storm that leads to those distorted thoughts and behaviors around food and body image.
So how do we approach recovery? It seems like it would take a multifaceted approach.
It does, and this handbook emphasizes that it's really a team effort. It's not just about seeing a therapist and talking about your feelings, although that's a big part of it. It's about getting support from multiple sources.
So what does that team look like? Who's involved in eating disorder treatment?
Well, therapy is key, for sure. Individual therapy, group therapy, sometimes family therapy. It's all about helping the person understand their eating disorder, develop healthy coping skills, address those underlying emotional issues. But they also need nutritional counseling.
Makes sense. So learning about nutrition, debunking those diet myths, developing a healthy relationship with food.
Exactly. It's about nourishing your body, not punishing it. And sometimes medical monitoring is needed too. Eating disorders can take a real toll on your physical health, so it's important to address any complications that might arise.
It's about healing both the mind and the body.
Couldn't have said it better myself. And lastly, sometimes medication can be helpful as well, particularly for managing those co-occurring conditions like anxiety or depression.
So it's about giving people all the support they need to get back on track. It really is a team effort. Okay, we're on a roll here. What's our next deep dive?
Let's talk ADHD. It's a condition that often starts in childhood but can definitely stick around into adulthood.
Right. I think a lot of people think of ADHD as that kids can't sit still thing, bouncing off the walls, can't focus in school. But it's more nuanced than that, isn't it?
It is, and the handbook does a good job of explaining that ADHD is not just about hyperactivity. It's really about challenges with attention, impulsivity, and executive function, those higher-level thinking skills that we need to manage our lives effectively.
Okay, break those down for me. What are the core features of ADHD?
The handbook talks about inattention, hyperactivity, and impulsivity. So inattention is that difficulty focusing, being easily distracted, losing things, making careless mistakes.
It's like your brain is jumping from one thing to the next, and it's hard to stay on task.
Exactly. And then hyperactivity, that might look like restlessness, fidgeting, talking nonstop, having trouble sitting still.
Like their body's always in motion, even when their mind wants to be still.
Right. And impulsivity, that's about acting without thinking, interrupting others, blurting out answers, having difficulty waiting their turn.
So they know they shouldn't do it, but they do it anyway.
Yeah, exactly. It's like the impulse control is lacking behind. And one of the key points this handbook makes is that ADHD doesn't always disappear in adulthood.
Really? I thought it was something you just grew out of.
Not necessarily, and that's a really important thing for therapists to understand. Adults with ADHD, they might struggle with different things than kids. Disorganization, procrastination, trouble managing time and responsibilities, problems in relationships, even job instability. It's like those same core challenges are still there, but they manifest in different ways.
Interesting. So it's not that they become lazy or irresponsible, it's that they still have that underlying ADHD.
Exactly. And a lot of adults with ADHD never got diagnosed as kids. So they might be struggling, blaming themselves, feeling like they're not good enough, when really it's the ADHD that's holding them back.
That's so sad to think about, all those years of feeling inadequate, when really it's a brain-based condition that they could get help for. So what's actually going on in the brain with ADHD?
The handbook talks about problems in those brain areas that control attention, impulse control, and executive function. It's like those circuits aren't working as effectively as they should. And those brain chemicals we keep talking about,
Dopamine, serotonin, are they involved in ADHD too?
they are. Dopamine and norepinephrine specifically seem to play a key role. They're involved in motivation, reward, attention, and when those systems are messed up, it can lead to those ADHD symptoms.
So it's not just about trying harder, it's about actual differences in brain function. Fascinating. What about treatment for ADHD?
Well, the handbook really emphasizes the multimodal approach, which basically means combining different strategies to create a tailored plan for each individual.
So it's not one size fits all.
Definitely not. Medication is often a big part of it, especially stimulant medications like Ritalin or Adderall. Those boost dopamine and norepinephrine levels in the brain, which can really help improve focus, reduce hyperactivity, and help with impulse control.
It's like giving the brain a little extra support to function better.
That's a good way to think about it. But meds aren't a cure-all. Therapy is also really important. Behavioral therapy can help people with ADHD develop those practical skills: organization, time management, impulse control. It's about giving them the tools to succeed.
So they're not just relying on medication, they're also actively working on developing those skills.
Right. And then for kids and teens with ADHD, educational support is super important. That might mean things like accommodations in the classroom, like extra time for tests or assignments, or a quieter workspace to help them focus. And for adults with ADHD, similar accommodations in the workplace can be really helpful. Flexible hours, a quiet workspace, whatever it takes to help them thrive.
It's about creating an environment that supports their success. I love that.
Right. It's all about finding what works for each individual. Okay, ready for a topic that's a little heavier?
I think so. What's next on the agenda?
Dementia-related cognitive disorders. It's a topic a lot of people are afraid of, and understandably so.
Yeah, it's not exactly lighthearted stuff, but it's important to talk about because dementia is becoming more and more common as people live longer.
That's true. And the first thing this handbook does is clarify that dementia is not a normal part of aging. It's a decline in cognitive function thinking, remembering, understanding that actually interferes with daily life.
So it's not just about forgetting where you put your keys every now and then. It's about more serious memory problems that affect your ability to function.
Exactly. Alzheimer's disease is the most common type of dementia, but there are others too. And while we don't have a cure for dementia yet, there are treatments that can help slow down that cognitive decline and manage the symptoms.
Okay, that's good to know. So there is hope, even though it's a scary diagnosis. What's actually happening in the brain with dementia? What's causing that decline?
The handbook talks about the buildup of abnormal proteins in the brain as well as the loss of brain cells. It's like the brain is being damaged, and that's what leads to that cognitive decline.
So it's a physical process, not just a psychological one.
Right, and these changes can affect everything: memory, thinking, language, behavior. It often starts subtly, like forgetting appointments or names, having trouble finding words.
Those senior moments that we all joke about.
Right, but over time it can become much more severe. People might get lost easily, have trouble with day's tasks, experience personality changes. It can be really heartbreaking to witness.
It is. It's like losing the person you love bit by bit.
It's tough, but there are things we can do to help. Medication can sometimes slow down that cognitive decline and manage some of the behavioral symptoms like agitation or aggression. For Alzheimer's, they often use medications called acetylcholinesterase inhibitors, which boost a neurotransmitter that's involved in memory. And other medications might be used to address specific symptoms, like antidepressants for depression.
So it's about finding the right combination of meds to address the individual's needs. And I imagine therapy plays a role too, right? Both for the person with dementia and their family.
Absolutely. Therapy is really important, especially supportive therapy. It's about helping both the individual and their family cope with the emotional and practical challenges of dementia. And lifestyle changes can sometimes make a difference too. Mental stimulation, like puzzles or games, can help keep the brain active. Physical activity and a healthy diet might also protect the brain and slow down that decline.
So it's that mind-body connection again, keeping both active and engaged.
Right. And lastly, caregiving support is crucial. Caring for someone with dementia can be incredibly challenging, both physically and emotionally. So caregivers need a lot of support themselves: respite care, education about the disease, support groups. It's a tough job, and they need to be taken care of too.
Absolutely. It's a team effort, for sure. Okay, we've talked about a lot of heavy stuff today. Ready for a slightly lighter topic?
Sure. What do you have in mind?
Obesity. I know it's a serious health concern, but it's also something that a lot of people struggle with, and I think there are a lot of misconceptions out there.
I agree, and the handbook addresses obesity head-on, making it clear that it's far more complex than just eating too much and not exercising enough. It's a medical condition, and it's influenced by a whole range of factors: genes, environment, behavior. It's not a simple equation.
Okay, so what are we really talking about when we say obesity? What's the definition?
It's basically having excessive body fat. And that excess body fat increases the risk of all sorts of health problems like heart disease, diabetes, certain cancers. So it's not just about how you look, it's about the impact on your overall health.
Right, it's a medical condition, not just a cosmetic concern.
Exactly. And like I said, it's not just about willpower. Some people are genetically predisposed to gaining weight more easily. And environmental factors play a huge role too, like having access to healthy food, your socioeconomic status, even exposure to certain chemicals that can disrupt metabolism.
So there are a lot of things working against people even before they make a single food choice.
Absolutely. And then, of course, behavior does play a role. What you eat, how much you exercise, your sleep habits, it's complex.
So how do we approach obesity, given all of that? It seems like it's not as simple as just telling people to eat less, move more.
It definitely is not that simple. The handbook talks about lifestyle changes being the foundation, so diet and exercise are key, of course. But they also acknowledge that medication can sometimes be part of a comprehensive treatment plan, especially for people with significant health risks related to their weight.
So it's not about using medication instead of making healthy choices, but as a tool to support those choices.
Exactly. And what kinds of medications are we talking about here?
The handbook mentions appetite suppressants, which help reduce hunger and cravings. And then there are medications that affect metabolism. Some help increase how much energy you burn, others reduce fat absorption.
So they're targeting different aspects of how your body processes food and weight. Interesting. But the handbook makes it clear that medication should always be used along with those lifestyle modifications like diet and exercise. And it tends to be most effective for people who have other health risks related to their obesity.
Makes sense. Okay, we've covered a lot of ground today. We've got time for one more deep dive, right?
Sure. What's on your mind?
Aggression. It's a topic that often makes people uncomfortable, but I think it's important to talk about. Because aggression can be a symptom of all sorts of things.
It can, and the handbook is really good at pointing out that aggression is a spectrum. It can range from irritability all the way to full-blown violent outbursts. And often, it's a symptom of something else going on, a psychiatric disorder, a neurological condition, even a medical issue.
So it's not just about having a bad temper. There could be other factors at play.
Exactly. Some people might be genetically predisposed to be more aggressive. Others might have a history of trauma or abuse that's shaping their responses. And some medical conditions, like brain injuries or hormonal imbalances, can also trigger aggression. Even some medications, especially ones that affect the central nervous system, can have aggression as a side effect.
So it's really important to understand why someone is being aggressive, not just try to suppress the behavior.
Totally. It's about addressing the root cause, not just putting a Band-Aid on it. And that might mean different things for different people. Sometimes it's medication, sometimes it's therapy, sometimes it's a combination of both.
So what kinds of meds are used for aggression? What are some of the options?
It depends on what's causing it, of course, but the handbook mentions antipsychotics, mood stabilizers, antidepressants, even anti-anxiety meds. It really varies depending on the individual.
So it's about finding the right medication to target those underlying mechanisms that are fueling the aggression. And what about therapy? What role does that play?
Therapy can help people understand their anger, learn how to cope with it in healthy ways, and communicate their needs more effectively.
So it's not about never getting angry. It's about learning how to manage that anger.
Exactly. They talk about anger management techniques, which teach people practical strategies for dealing with those angry feelings in the moment. Cognitive behavioral therapy, CBT, can help change those negative